and eventually die. Most of the filtration process occurs in these tubules inside the kidneys. Acute interstitial nephritis is another cause. This means inflammation of the interstitial renal tissue, which is responsible for salt and water processing mainly. Injuries to renal tissue and cells can also be a cause. Also, blood clots within the blood vessel within the kidney can obstruct blood flow, and chronic changes can also be caused by blood vessel disease. And finally, polycystic kidney disease. It is a genetic disorder in which numerous cysts grow in the kidneys. Postrenal. Post-renal failure includes the issues with movement of the urine from the kidneys to the ureters. The problem can be caused by blockage in the way of the urine being excreted by the kidneys. Thus, it is also known as obstructive renal failure. Obstruction in the ureters can be caused by a kidney stone, cancer or tumor in the kidney or in the urinary tract organs, or structures near the urinary tract that may block the discharge of urine, and also some medications. Obstruction in the bladder can be caused by bladder stone, bladder cancer, enlarged prostate, blood clot, and finally a neurologic disorder of the bladder, which leaves it unable to contract. With appropriate treatment, the condition can be reversed. However, if the blockage persists for too long, it can damage the renal tissues and cells. Signs and symptoms. Signs and symptoms of acute renal failure may vary depending on the type and the site of the dysfunction. In most patients, there are no prominent symptoms, but generally the signs and symptoms of the condition can include changes in urination, such as little or no urine at all, or excessive urination at night, vomiting or nausea that can last for days, fatigue, a slow, sluggish movement, hand tremors, prolonged bleeding, bloody stools, nosebleeds, high blood pressure, shortness of breath, breath odor and a metallic taste in the mouth, reduced appetite, non-stop hiccups, flank pain between the hips and the ribs, and swelling caused by the accumulation of water in the body. Also bruising easily, and seizures can occur. Diagnostic test. In case of medical manifestations of acute renal failure, the patient is suspected to have the condition may have to go through certain diagnostic tests and procedures to verify the presence of acute renal failure. These diagnostic tests can include a urine test, which is also known as a urinalysis. It is used to detect abnormalities that can indicate renal failure. Urine output may also be measured. It helps find out the cause of the renal failure because of the amount of urine that's produced over a 24-hour period. Blood tests are also used. It can be used to detect the increasing levels of creatinine and BUN. The concentration